a patient diagnosed with MS today in 2022, it's amazing. There is so much we can do for you. We can work out your risk factors of progression. We can treat you with effective treatments. And, actually your prognosis is actually really good. Your life expectancy isn't that much it's in the order of magnitude of if you didn't have MS. When it's not a life-limiting condition, and actually your quality of life can remain amazing throughout that time. The problem is services in the NHS, and I don't think it's unique to the NHS, I think it's the same internationally, are struggling to cope with the increased workload. So there are new drugs that require new monitoring. There are new risk factors, which means we need to monitor. There is the patient expectations have increased, and quite rightly so, but the care teams haven't kept up with what's needed. And that's the paradox that we're referring to, is in it's great that the research and the evidence and the risk factors is all being known about, but unless we have the services to treat these things, it's kind of, what's the point? We need to think differently. So we found out through our research, and the research we did was we interviewed through semi-structured interviews all of the 70 centres in the UK to look at their surveys. Who's providing the care? Like what healthcare professional? What is your use of data? And there were loads of other questions. But also we need to think differently. We know there's a shortage of neurologists in general across the world, and especially in the UK, but also the shortage of MS specialists. But even if tomorrow the MS services across the world wins a lottery and funding was unlimited, and we were able to gain the funding for unlimited amounts of MS specialist consultants, nurses, pharmacists, therapists, there isn't that healthcare professional out there to come and fill that gap. So we need to think differently. How can we think differently? So if you're listening to this and you work in MS, or you're working in any field, what do you do that actually could be done by someone else? Now, obviously, some of the things you do that could be done by someone else allows you the brain time to think about other things you're doing. Because if you're working at the top of your license 100% of the time, actually, it's a quick road to burnout. But actually, what are you doing that is actually, I don't think we're at 100% of top of our license, but I think some of us are actually only doing 10% top of our license because there's no one else to do the other stuff. And I think it shouldn't always be people. So in the past, healthcare systems have been great at looking at actually, this job could be done by another healthcare professional, whether that could be done by a nurse or a doctor, a pharmacist or a therapist, etc. But actually, what about technology? What can be automated? What can be taken on by the patient? What can be done to actually streamline and make us more efficient, but also make for a better outcome for the patient? Because actually, we're more efficient, they will gain better outcomes too. So although it sounds like, we're pulling back and we're trying to make it all very efficient and like conveyor belt like, actually, in the end of it, it does make for a better experience for the patient.